Victor Hugo was right when he said there's nothing more powerful than an idea whose time has come. Yes, the idea of freedom, liberty, and justice for all. Yes, that was the idea. But I declare that now is the time. And if America is going to have a chance at living out the true meaning of its creed, that we hold these truths to be self-evident, that all men are created equal, then we cannot afford for this nation or its leaders to have selective ambition.
Welcome to the Policy Lowdown, the podcast from the Maryland Center on Economic Policy, offering straight talk on the policies that matter most to Maryland communities. I'm your host, Kevin Slayton. It is undeniable that health is at the center of everything in our lives. Without it, we are limited in our work, our ability to take care of our families, or to simply live out our daily lives. However, many people are unable to access or afford health care services due to the lack of insurance, high cost of care, or transportation barriers, among other things. This is especially true for the thousands of immigrant Marylanders that do not qualify for services or coverage due to their immigration status. Today, I'm excited to be joined in conversation about expanding health care for the immigrant community here in the state with two of my favorite people. First, we have Dr. Michelle LaRue from CASA de Maryland. Dr. LaRue is a public health professional with over 20 years of experience. And Dr. LaRue has spearheaded a number of national and international public health initiatives, all while working for a number of national nonprofit organizations here in the U.S. that focus on health literacy, health inequities, health access, cultural competency, and the list goes on. Dr. LaRue, thank you so very much for being here today.
Thank you. I'm so excited to be here. Thank you again for the invitation.
We also have my colleague and office mate, Jasmin Aramburu. She's MedCep State Policy Fellow. She comes to us with a social work background, works on many different issues here at MedCep, including those directly impacting the immigrant communities throughout the state. Jasmin, glad you're here with us.
Thank you for having me.
I would love it if you could each share a bit more about yourselves and how you came to this particular work. Dr. LaRue, what would you like our guests to know first about you?
Thank you. I am so dedicated to the work that we do at CASA. I'm a physician by training, but was very disheartened in my training and in my profession of how many people were left out of the system and had really major struggles in even accessing care. And so I've decided to dedicate my professional career to public health, to helping our community broaden access to all on such vital, literally life-saving services.
I'm always interested in people's journey. Was there something particular in your family, in your community, or something that sort of struck that nerve? Or were you, I'm a pastor by trade, did you have a Damascus Road moment?
Well, my father's a human rights activist, has been all his life, and I think it was just in me. And so to be able to see different tiers of people, I mean, we're not second-class citizens just because we're immigrants in this country. And so really fighting for justice, fighting for all human rights is in my blood. And so I'm just putting the healthcare spin on what is in my blood.
Outstanding. Jasmin, tell us a bit more about how you became interested in this work.
Yeah, so as you mentioned, my educational background is in social work. And so that led me to doing a lot of different direct service jobs in Chicago, where I'm originally from. And one of the positions that I worked as was as a case manager at a federally qualified health center, which is a community-based health center that tends to provide services for communities that are underserved or low income. And in this role, I was primarily working with Latinx or Spanish-speaking patients, helping them navigate the complexities of the healthcare system. And this included simple things, or what some people would see as simple, like scheduling an appointment with a specialist, to other more complicated things like getting services that were cost-free or reduced cost, such as medications that are, as Dr. LaRue pointed, services that are life-saving, right? And so seeing all of these barriers led me to think about what can be done at the policy level to enact change and looking more into macro level work.
I think it would be great to start this conversation learning more about the issue at hand and trying to understand the scope of the problem here in Maryland. Jasmin, can you give us an overview of the uninsured rates here in Maryland and in the country and why it makes sense to expand coverage to undocumented immigrants here in the state?
Yes, of course. So the ability to get proper care, that's a nationwide issue, of course. But as we know, people in the immigrant community, particularly undocumented immigrants, tend to have disproportionate uninsured rates. And this is a result of designed systematic exclusion of this community from accessing services, right? And so many may resort to services that are provided by centers like federally qualified health centers, right? But these are not enough, and they are oftentimes also overburdened. And the reality is that a lot of people in the undocumented immigrant community are also low income, and so they cannot afford to purchase private insurance or uphold all of the out-of-pocket insurance. And so when looking at the statistics nationwide, we see that almost half, or about 46% of undocumented immigrant adults who are non-elderly are uninsured. And this is compared to around 8% of US citizens. And then when we look at immigrants that are not undocumented but are also not US citizens, we see that around 1/4 of them are also uninsured. And again, this is a result of, for example, the 5-year bar, which prohibits these immigrants from becoming eligible for services like Medicaid. And these nationwide statistics also say a lot about what's happening in the state as well. So the stats mirror what's happening in the country. Almost half of the undocumented immigrant population in the state is also uninsured. And it's interesting to know that because in Maryland, the overall uninsured rate is only 6%. So it's not super big. But when looking at data from 2021, we saw that non-citizen immigrants accounted for about 38% of the uninsured population when they only make about 7% of the population statewide. And then when breaking it down even more by race or ethnicity, we saw that about 1 in every 5 people in the Latinx community are uninsured. And of course, the immigrant community is not specific to a particular nationality, race, or ethnicity, but in Maryland, a significant portion of the immigrant community is Latinx, right? And this was, again, when you compare it to other racial groups, we saw that the uninsured rate for Black Marylanders was 6%, and for white Marylanders, it was 3%. So, we're seeing these numbers, and we have to think about the fact that there is tremendous need for expanding health coverage regardless of status, just like lack of transportation, instances of discrimination in the healthcare system, safe housing, language access. All of these things are determinants of health, and immigration status is also a really big one.
Yeah, that 46% number jumps off the pages at you. And again, it speaks to a civil nation, how we often are just so complicit. We recognize here we are at 6% as a state, and we are very comfortable to watch those who we work with, those who we live with, walk day by day, take on the same risks we do, encounter the same issues we counter, even the children that go to school with our children, and we're okay as a society knowing that they're uninsured. That leaves a lot of work for us to do as a state, not just on policy, but on I would say as a preacher, on our hearts. Lawmakers have tried to expand health care coverage for residents. We know that with some successes, but also some challenges. So Dr. LaRue, can you talk more about the state's role in addressing health disparities? What's been achieved and what is still needed?
Yes, thank you. I think this is a supremely important question. In Maryland, we believe everyone deserves access to health care, and healthcare is a human right. And most importantly, that your immigration status should not determine whether or not you're able to seek a doctor or get treated for illness. We have seen the state step up its responsibility in providing equitable environments for all Marylanders through the DREAM Act that allowed immigrant students to pursue higher education, improved education equity, the passage of driver's licenses for undocumented, creating safer roads and building more trust with immigrant communities. And we have multiple different examples of this. And we know that as was just being mentioned, the health disparities mostly fall on communities of color, including undocumented communities. So the passage of the Healthy Babies Act was one crucial step, moving the needle when it comes to access to care in Maryland. And just for the last couple sessions, we've been introducing the Access to Care Act that's broader than the Healthy Babies, and that would open the Maryland exchange to immigrants and remove the immigration status from its eligibility requirements, allowing all Marylanders to purchase ACA-eligible health plans. This bill has garnered support in a variety of stakeholders, namely Maryland Hospital Association, the Maryland Health Benefits Exchange, insurance providers, community health centers, social justice groups, and many other grassroots supports. Broadly, there are some challenges in the Senate. We are confident that we're going to get everyone on board with this legislation, that this resonates with our vision of creating a healthier Maryland. And we're really proud of the support that we've gotten in the House on this bill so far.
Great. CASA has done great work over the years, advocating in Annapolis as a way of transparency, Dr. LaRue. I'm very proud to pat myself on the back. And I won't say what year, but a few years ago, I was CASA de Maryland's Advocate of the Year. I remember that. And so I've been excited to work alongside them for years. And we know that CASA members are active, continue to be active. And those members are at the core of any grassroots organizing that happens. CASA shows up. Whatever the issue is, that your community, your members, your advocates, they're always there. So can you talk more about how CASA members, the actual member stakeholders, if you are, advocating for their communities to get their healthcare needs met?
Yes, everything that CASA does is member centered. Our communities form committees. We have a very structured process that they are the ones that vote on what are the priorities for CASA and healthcare, especially coming out of the pandemic, where so many of our community members were essential workers, were at the front lines of the pandemic, that did not have work from home options. Coming out of that, we know that healthcare has now been voted as our number one priority. And so we're putting our full effort behind this. Our community members have met with legislators to share their personal stories, many times stories of having to delay care because they haven't been able to have access to primary care or specialty care, and really having to rely on the emergency department in the hospitals to then treat exacerbations of and complications of chronic diseases that should be well managed if they had access to healthcare here in the state of Maryland.
Now, we see nationally a lot of the behavior of some of our elected officials toward the immigrant community is deplorable. We haven't seen behaviors in this way, sort of backed by policy in a long time. So while Maryland is not facing this issue alone, Jasmin, can you talk about what we're seeing on the national landscape and any successes that we see in other states in particular?
Yeah, of course. So we are definitely continuing to see successes, and different states have taken different approaches to expanding health coverage for their immigrant communities, including their undocumented residents. Some states have extended state-funded Medicaid-like coverage to low-income residents regardless of status, and there are also some states that have or will extend coverage as Dr. LaRue was mentioning, through their state's marketplace or health exchanges, which are platforms that were made available through the Affordable Care Act, that allow people to purchase and compare plans. And it's also a platform that allows people who purchase those plans to get tax credits from it.
Yeah, even more interesting, in this climate of fear, I just want to sort of hammer that home again. Did you have some more? Go right ahead.
Yeah. No worries. So some states have also decided to cover specific age ranges. So currently over a dozen states plus DC provide or will provide Medicaid-like coverage to income eligible children regardless of status. And that's amazing. And this includes states that have expanded coverage to adults like California, Oregon, Illinois. But also we're seeing new states join the movement like Utah, Minnesota. And it's incredible to see this momentum in expanding immigrant inclusive policies, especially for our children who can be a very vulnerable population health-wise. Also, as of July of 2023, 5 states plus DC have expanded some type of state-funded coverage to adult immigrants, including those who are undocumented. Many of them, especially those that are enacting more comprehensive Medicaid-like coverage, are doing so in different phases. So starting with perhaps the elderly population and then going down depending on age groups. But there's also states like Colorado who are beginning to use their state funds to provide, again, marketplace insurance with no premium costs to people under certain income eligibility criteria. For them, it's specifically with people who have income below 138% of the federal poverty level. Washington is another example that it's going to allow residents starting in January 2024 to purchase insurance through their state exchange. And these residents will be able to purchase insurance if their incomes are up to 250% of the federal poverty level. So we're seeing all of these successes, and we're seeing states that are, prioritizing the health of their residents and making sure that that priority is embedded within their state budgets. And one important factor in all of this is that of affordability, right? Because it is not enough to just extend coverage to everyone regardless of immigration status. We have to make sure that they are able to afford it. Otherwise, we go back into the cycle of uninsured rates that remain unchanged.
Now, again, in looking at the national climate, and at times it seems increasingly hostile towards immigrants, as we see it on the 6 o'clock news. We see things happening in Texas and different border states. I feel comfortable in saying that so much of it is rooted in ignorance. And we look at the history of this country, how we've moved forward and created access for so many different communities, because really we are a nation of immigrants. And we think about that. There are other issues that need to be addressed, even in a state like Maryland. What are some of the things about particularly immigrant health care that you would like others, those who are listening, to know more about, or that you see missing in the mainstream media?
Yes, thank you for that question. As Jasmin was just mentioning, many states have already taken it on to expand access to care to immigrant communities despite their immigration status. And Maryland has done great strides in lowering the uninsured rate now down to 6%. However, immigrants have been completely left out, and that's not acceptable. We need broader, affordable, as Jasmin was mentioning, access to care, and opening up the exchange with subsidies will make a great stride. And not only that, but it also will stabilize the marketplace a lot more for all of Marylanders, and lower the costs. We also know that Because of EMTALA, hospitals are required to give life-saving care, and many times that is the only option that our communities have in treating what would be normally well-managed preventable illness. And we know that hospitals take on that economic burden of uncompensated care. Just in fiscal year 2020, hospitals provided more than $840 million in uncompensated care. And that all can be eliminated through broadening access to the health benefit exchange, as well as just it's going to affect all of our wallets by stabilizing the healthcare system in the state of Maryland. And so we are also going to be benefiting those that currently are insured by seeing that decrease. We also know that immigrants pay taxes here in the state of Maryland and support many of these social programs and just don't have access to them. And so they are paying into systems that they sadly do not have any access to be able to receive that care.
That's an interesting point. I often remember in my early years at the Public Justice Center, Dr. LaRue, when we were advocating for immigrant workers down on the shore. And I, early on, I saw the hypocrisy in the policies around H-2B workers, permitted for a seasonal time to help us get to a certain place. And it's sort of like when we're done, then we move on without considering the other issues, or challenges that individuals face in trying to do the work of helping us to sort of move forward. Jasmin, anything you'd like to add?
Yeah, I think going back a little bit to one of the questions that you asked earlier about why it makes sense to expand coverage to a larger population, including undocumented immigrants. As Dr. LaRue pointed out, of course, there are financial but also public health incentives to expanding coverage. We see that on the financial side, work productivity is associated, right, with health coverage. So if you're insured, you are less likely to call in sick, and also less likely to decrease any earnings from missing work. In addition to that, increasing coverage also reduces the burden of medical debt. Instead of focusing on how you're going to pay your medical bills, families can focus on purchasing basic necessities, circulating that money back into their local economies. And even housing issues like evictions are reduced for those that are, for the people who are low income, because they have some type of coverage available to them. And then again, on the public health side, we see that expansion of health coverage leads to improved health outcomes, affordability, overall access to care. We see that states that offer coverage to children regardless of status, those children are less likely to be uninsured, and as a result, less likely to have forgone medical, dental, or any type of preventative care. And then just to echo everything that's been said, a big lesson that we've learned from the pandemic is that the health of our communities are intertwined and are dependent on each other in being healthy, and that starts with coverage.
Mm-hmm. Well, thank you both so much for sharing your knowledge and helping our audience to better understand the policy decisions affecting Marylanders' health. It's been a great conversation, I believe. Dr. LaRue, what would be your advice to any of our listeners who want to work on improving access to health care for vulnerable communities and who want to reach out and work with CASA?
Yes, we're very excited to work with all sectors of the community to pass this legislation. We know that this is to increase access to care, focusing on the immigrant communities, but this is really a bill that would fortify the marketplace for all Marylanders. This will lower premiums. The more the participants we have in the exchange, the better overall economically the exchange will be, and we will see that in our own wallets as well as premiums go down as well. And so anyone who wants to get involved, I encourage them to speak to their legislators showing support for this bill. They can connect to CASA. We're having a multitude of different programs coming up as we're leading into the legislative session, especially during the session. We're actually going to be doing a march later on in the year, and so more details to come on that, and hopefully everyone can come out and participate, and really just making sure that we bring out the voices that this is important to all Marylanders and that this is good for all of Maryland.
Hopefully we can get you and Gustavo back in here before that rally to have a conversation about it. Jasmin, I'm betting you have something you'd like for our listeners to know about ways they also can get involved.
Yeah, of course, I'd like to echo everything that Dr. LaRue has said. It's so important to work with community partners in your area, joining coalitions, uplifting the voices of the communities that are directly affected by these policy decisions, and just remembering the importance of funding initiatives, right, that benefit marginalized communities, that build health equity in the state. And though it is a financial investment, it is one that is absolutely worthwhile. Because the reward is a healthier, a happier Maryland, right? And also just staying up to date with any activity that's happening in other states. I do believe that Maryland can sample also from what other states are doing. There are great models out there, and we hope that we can be the next to join the movement.
Again, I'd like to thank our guests, Dr. LaRue and Jasmin, for joining us today. You can find podcast archives and resources from this episode at mdeconomy.org/policy-lowdown. While you're there, you can sign up for our email list or support the Policy Lowdown by making a donation to the Maryland Center on Economic Policy. The Maryland Center on Economic Policy this year will be celebrating its 10th anniversary on September the 27th. Come party with us at the Reginald F. Lewis Museum. Remarks will be shared by the Reverend Dr. Starsky Wilson, who is currently president and CEO of the Children's Defense Fund. He will be joined by other guests, and you can find more information about this upcoming event by visiting mdeconomy.org/events. You can also find the Maryland Center on Economic Policy at MD Economy on Twitter and Instagram, and MD Economic Policy on Facebook. Again, thank you for joining us, and see you next time.